You've probably heard the term concierge medicine, but what does it actually mean? Is it only for the wealthy? Is it even legit?
In this episode of Out of Network, we break down what concierge medicine really is and what it's not. From 24/7 access to same-day visits, we share how it can give back power back to the patients and joy back to the doctors. Spoiler alert, it's not about luxury, it's about listening. So join us today for a great chat.
I would really like to talk about really the foundation for this podcast, and that is concierge medicine.
Woohoo!
Exactly, right? Fun, exciting topic. And I get the question all the time, what is concierge medicine? And then there's this other topic of DPC or direct primary care.
Right.
I guess, what is your definition of concierge medicine?
So I think the way I tell my patients is concierge medicine is, and you can have concierge medicine in all sorts of different levels. You can have concierge primary, you can have concierge cardiologist. It's what we do is concierge primary or concierge internal medicine. And imagine having a primary doctor who is focused on you and focused on less on the focus on time and also available more frequently than the average provider.
So it's a way of having better access, if you will, better access.
Right. So, at our clinic, we offer same-day visits, guaranteed appointments within 48 hours. This is a unique offer that it happens to providers as opposed to the normal system, which could be months to even longer to get a scheduled, established primary care physician.
And so there's a price tag for that.
There is a price tag. In our clinic, we have a certain price tag that only provides for the guaranteed timing.
Okay.
To know that you are making sure, as a concierge physician though, the difference between myself and a general practitioner in a hospital system is that in order for me to guarantee that 24 to 48 hours a visit, I can't have a very large panel of patients.
Right.
The average physician, average internal medicine physician in my town, Tampa and St. Petersburg, an average physician has a panel of 3,500 patients.
Wow.
So how are you supposed to guarantee a 24 to 48 hour visit? It's impossible.
You can't.
And so
they're going to be told to go to the urgent care.
Right. And so this is a response to this. This is saying that for the select group of patients who have chosen me as their physician, that I will guarantee I will make time for them.
So if I can summarize, concierge medicine is a mode of healthcare delivery by which the consumer will pay a membership fee. And that fee can vary based on each individual model, right? And what they're paying for is access. They're paying for 24/7 availability to a provider. They're likely paying for no waiting, if I'm understanding that correctly. So if you're not having 3,500 patients on your panel, you may have 200 patients on your panel. So when patients have an appointment at 11:30, they're going to be seen at 11:30, right?
Exactly.
They are paying for your time and the opportunity to learn more about wellness services that they may not often get in a traditional practice, right?
Okay.
So concierge medicine, is this a new thing? Has this just been something for doctors to get rich quick? Is it ethical?
Yeah.
To charge a patient for this?
Yeah. So I love the fact that question's come up. So I think the first time I had been, heard about concierge medicine, there used to be a TV show on USA Network.
Royal Pains, right?
Was it Royal Pains? It was something about this kid who used to go to the Hamptons and he would be like their private concierge
Yes.
doctor.
It was Rural Pains.
It was,
Mhm.
and I remember watching it, and like, you know, he was this wonderful doctor who went house to house, Hampton house to Hampton Palace. And so I thought it was just for the ultra rich.
They called it concierge medicine, but I think it should have been called private medicine.
Private
right?
medicine. Yeah, that's right. Yeah. And so, yeah, this doctor was at their beck and call,
Yeah.
and it seemed like it was only for the ultra rich.
Yeah.
And then I just got a little bit of reading about concierge medicine, and then I contacted you.
Sure. Yeah.
And I was educated quite a bit about what the reality of concierge medicine is. And one of the worries I had about joining concierge medicine,
Yeah.
developing it, was I was worried that I wasn't going to get enough complexity or acuity. You know, as a physician, I still want to take care of sick people.
I think you are also worried about the availability too, because when
Yeah.
people hear about 24/7 access to a physician, the next thing that may go to your mind is, I'm not going to have a life.
Yeah.
Right? I'm going to be at someone's truly their beck and call.
Yeah. Yeah, and remember that Hamptons show, that guy was flying out all the time.
Right.
And I was like, that doesn't sound like a great experience.
But he was wearing Cartier.
Yeah, that was I promise you.
He looked good.
Cartier.
He looked good. He had all the luxury clothing on. I want to be a concierge doctor just for that.
Yeah, just for that.
I'm kidding.
I still wear blue jeans and drive a pickup, unfortunately.
So I will just set the record straight that it is not necessarily like that.
Right.
And the number one reason concierge medicine exists is because there's physicians like us that truly value patient care.
Right.
And yes, we do want a smaller panel of patients because I don't ever want a patient to wait for me ever again.
Yeah.
I want patients to have the convenience and the luxury of having a physician that will be there for them. And no, I am not always at their beck and call. You know, there are systems in place, but concierge medicine is really for patients who value great care and need maybe a better level of service.
Yeah.
You know, talk about the patient who has 14 different medical conditions. How are they being treated or triaged in a traditional setting? They're getting lost in translation, right?
Right.
So
when it's funny you said about the waiting rooms, when we were building our medical practice, we had 4 or 5 people who came to our clinic to look at, design. And the first person came in and said, you need to bust down 2 walls to expand the waiting room. And I was like, I don't want a waiting room.
mm-hmm.
And he looked at me and he's like, you're crazy. You need a waiting room.
Right.
Then the next designer came and said, you don't need that big of a waiting room, but you need enough for 8 people. And I thought, that isn't what I'm trying to do. I'm trying to create a system so that my patients feel valued, and they feel not only are they valued as a person, but I'm valuing their time.
I like your system in that you are the one that's rooming the patient, right? When they come in, you are greeting them at the door, and then you are escorting them to the room.
Right.
So
I think when I met you, one of the things you described was the 4 seasons model.
mm-hmm.
Just making sure that when the person came into the building, they felt like they were in a level so high that they were on a different experience.
First impressions are everything, right? And I wanted patients to know that they had someone that was going to be there for them, to share the journey with them, to advocate for their health. In today's broken system, it is hard to do that successfully and safely, actually, to be quite honest with you. Having experience in the outpatient world, seeing 50 to 60 people a day, I can only imagine potentially some things that I missed. And that really scares me.
Mm-hmm.
And unfortunately, in the current American model of volume-based care as opposed to quality care, I think that is, we're going to see some more problems, I think. And I think concierge medicine is an answer to that.
Yeah.
Talk to me about, again, going back, do you think it's ethical to charge someone for a membership fee to be in your panel?
Yeah. So that's a great question. And I think one of the things that medicine has done a very bad job of is nickel and diming patients.
Mm-hmm.
You know, a patient goes to the emergency room in the state of Florida and they have a minimum charge. A minimum charge. Imagine that. They walk through the emergency room door and it's $3,200.
Wow.
And if you're wondering about that, why? There's a sign at every ER by law that they have to write minimum charge $3,200. So nobody questions that, right? And then the insurance companies are left to pay for that, and then the insurance companies may not pay for it, and then the patient ends up with the bill.
You're right.
So to walk through the door of a emergency room, you had to pay $3,200. So the way I see it is, I feel that I am going to make sure that my smaller group of patients are valued.
Mm-hmm.
And for me to do that in the current system, I do have to charge them a small fee. And I mean, there are people who charge very high fees and, you know, their patients pay for it.
Right.
They
I think
feel
it's
that
based on location too. So wherever you are at and wherever your location is, I think I don't want people to think that there is this standard model that only the rich can afford this, that it is so much per month and that's only for the wealthy.
Right.
I think you can build a concierge model that I think is very affordable. And to your point of, if you are taking care of those patients that are preventing them from going to the emergency room, you're saving them in the long run.
I've already saved them $3,200 by me jumping the gun and saying, I got your back.
And we have statistics that show patients who are in a concierge medical practice, the ER admission rates are drastically lower. So
I was talking to an insurance individual, like an administrator for an large insurance company, and he was actually telling me that their insurance model is starting to look at concierge medicine more favorably than the primary current system, because, you know, they have noticed that that connection is really, really strong with the patients. And so they don't go and venture to see, you know, emergency rooms, urgent cares, even some, and I mean, this is something we can talk about later, but like not every patient needs to see a cardiologist.
Correct.
Right? That's what the purpose of primary care was, is to make sure that non-critical issues can be controlled by management by a primary.
Right.
What has happened in the current state is you have a heart doctor. You have a lung doctor. You have a kidney doctor. And the primary just basically makes sure your screening modalities are done. And even then, the GI doctors have set up their colonoscopies, et cetera.
No one's communicating.
Right. So there, it's all frayed. It's all over the place. And it's billed to the nth degree. Right? Patients are like, I got a cardiologist. I got a pulmonologist. Yeah, it's super expensive.
Right. And
the insurance company isn't going to pick up the tab for all that.
Right.
So you come to your concierge doc, the quarterback, and you pay a monthly fee, but you make sure that that connection is strong and your values are focused and your time is valued. I mean, it's a premier system.
Would you have a concierge doctor personally? I get that question a lot.
Yeah. So
right now at your age, would you have a concierge doctor?
So at my age, and I'm not because I'm one of them, I truly feel that I would. And it's because I have such little time in my day. You know, I'm so focused. My children's day is so packed. Their school, my work. I've got, you know, I as you know, I'm running the clinic. I'm also, you know, I do telemedicine to pay a little bit of my extra bills, and then I'm a hospitalist at another hospital. I'm running ragged.
So for someone like you, who is busy, who has a family, who has many other demands, having a concierge doctor would mean that if you needed something, you could be seen right away, not have to wait, have your prescription sent in, whatever thing that you needed to get taken care of, and be done and on your way.
And on my way. And the other thing is, and this is something, I know this sounds silly, but have you ever been to a pharmacy and your script is not in? And then the pharmacist calls the doctor and the doctor's office, oh, I don't know. I make sure, I know this sounds silly, but like I make that extra step to call the pharmacy.
Right.
Or like, did that med go through?
Well, half the time they're playing telephone where the pharmacist says, oh, I talked to the doctor and they're not getting back to me. And then the doctor is saying, well, we talked to the pharmacist. And meanwhile, the patient is just still waiting.
And they're just
I do the same thing.
Yeah. And I think that all that is customer service.
Yeah.
And because we are in the business of making sure our patients are satisfied from their experience.
Yeah. And patients, I think, are willing to pay a little extra, knowing how broken the system is, for that access, for that level of attention.
Yep, absolutely.
And care.
I kind of wanted to ask you a question. So I'm a baby concierge doctor. I'm brand new into the system. I have been in there for now just about a year.
Mm-hmm.
Our building and stuff. Actually, we've only been open for I think less than 6 months. But we learned quite a bit from you and Parker Medical and Structured MD. So you've been in practice for how long?
So I've been an attending physician since 2013. And I've been an entrepreneur, started the practice in 2017. So about 8 years.
So 2017. Now, in 2017.
And prior to that, I was a direct primary care physician for about a year. So a good 9-10 years.
So in the landscape of things, you were there, but less than a decade, but quite a bit.
Correct.
Concierge sounds like a new topic.
Mm-hmm.
Like I really heard about it within the past 2 to 3 years.
Yeah.
You have been involved in it for a lot longer. So you were more of like, one of the pioneers of this thing.
Yeah, maybe, makes me sound really important, doesn't it?
I mean, so what does it feel like to see what it used to be?
Yeah.
And to see what it is now?
I know the Las Vegas landscape. And first of all, concierge medicine just did not show up in the last 10 years. If you look back in history, I think one of the earlier concierge medicine offices actually started in DC. And they were taking care of a lot of, congressmen and women and diplomats and senators. And so it has not, I wouldn't say it's drastically old, but it's been around for a while. And so when I started the practice and knowing Las Vegas, I think the healthcare system in Las Vegas is extremely broken, and the bar has been set so low that patients are truly willing to pay for better level of care. And I tell patients at their meet and greets, I am nobody special. I am board certified in internal medicine. I love being a primary care physician. I'm nobody special, but I promise you that you are going to get someone that will fight for you, that's someone that will listen to you, someone that is going to share this journey, and someone that's going to remember you at the end of the day. I love being a doctor. I love taking care of people. And one of my favorite books that I read, I think I gave it to you actually, was a book really on what concierge medicine is and what it means to be a concierge doctor. And one of the very first chapters talks about successes and failures. And the number one reason concierge doctors fail is their lack of follow-up. Mm. And that resonated with me. And I think patients really want someone to know that they're going to be there. So yes, if a patient is having surgery, I'm going to find out and call prior to their surgery to see how they're doing. I'm going to make that extra effort to know that someone is there. You also talk about taking time when you walk into a room to sit down and not stand. I think that sets a certain precedence, and people recognize that and they will respond to that. And so I would say the journey to get to this point has been challenging, but being in Las Vegas, healthcare so broken, we didn't really have to do a lot for patients to identify what we have to offer. And, it's nice to look back almost 10 years and now have 3 physicians and have a waiting list.
Yeah.
And, my panel's been full for a long time, but I love growing the practice and teaching sort of these newer doctors my protocol on what it means to be a concierge doctor.
So developed your practice. You have, a few physicians under you. Your panel's full. So when you're looking now at the landscape of concierge medicine in the United States, you see my practice, you see other practices around the country. What do you think about where it's come to now? Do you like where it's going? Are you encouraged, or do you think that there's some changes that need to be brought?
I do. I think the way that, and I keep going back to this topic that the system is so broken, I think it's going to have to change. And I think the paradigm is going to shift where more and more doctors are going to go into fields like concierge medicine. I think it's only going to get more and more popular. That's why I think I'm really big on wanting to get into some of these graduate medical education programs or medical schools to really talk about the benefits of hospitality and healthcare and what that means. And, as I said earlier, you don't have to charge a patient a lot of money to be in their panel. It depends on, obviously, location, and I think maybe some of the services that you provide in the location that you're in.
So describe what you mean by hospitality and healthcare?
I think for me, living in the hospitality capital of the world, I have certainly grown accustomed to, it's a catchy line.
That's right.
I have certainly grown accustomed to walking into a resort where people stand, they greet you. And even at restaurants, the level of service is 100%.
Yeah.
And when you go into these resorts and these restaurants that you're going to have a 5-star experience.
Yeah.
Why can't we have that 5-star experience in healthcare?
Yeah.
In medical school, you and I are taught how to communicate. There's a way and an art of gathering information and presenting and talking to other physicians, right? But we don't know how to communicate very well to patients. And I see it all the time. And I think a lot of the problems is the lack of communication and what needs to be said or what wasn't said or this was interpreted wrong. So I think concierge medicine is only going to take off more in the future.
Yeah. We live in Tampa, and the landscape for concierge medicine is expanding quite a lot.
Mm-hmm.
There's a magazine that comes out every year. It says Tampa New Docs or Tampa Top Docs or something. And I think a lot of cities have these kind of things. And this year's magazine was filled with concierge doctors. Now, it was quite a bit. I was taken aback because, I'm a new business owner. I'm like, is this my competition?
Yeah.
But I also think, and this is the unique thing that sets us apart, competition is good. Competition makes skilled physicians work harder.
I agree.
Competition also makes good programs get better.
Mm-hmm.
And, we are constantly thinking, how can we make our patient happier? What can we do to make our patient's experience better? And I think that's really important. It also is going to provide an opportunity for some of those facilities that are concierge by name.
Right.
They're concierge by giving the dollar figure, but they may not be doing as you had mentioned, following up. They may be missing it, and that may go away from the wayside. You flip that to the current healthcare system, the current hospital system, hospital run big corporation systems. Right. They don't have a lot of competition, right? I work for an institution that's in the state of North Dakota. It's the largest employer in the entire state. It's the largest employer in 2 states. The largest employer in Ohio is a medical system. The largest employer in most of the states are healthcare system. What competition do they have?
Yeah.
They don't have much competition. So why should they make a better system? They got to make it efficient.
Yeah.
But do they need to make it a quality service hospitality? Not really.
Yeah.
They know that they're the biggest dog in the group, and they can, everybody's going to come to them.
Yeah.
And so I think we're
they don't need to focus necessarily on hospitality.
Right.
So,
and so that's part of where I think the great part about Concierge is that we're that response to that, that we have that opportunity to say, and again, this came from like years of me doing ethics, is time to sit down and talk.
Yeah.
Let's talk. What is your goal? What is your focus? And can I make you feel comfortable in this place?
Yeah. I want to go back for a second, Dr. Seth. So in a concierge medical model, patients sign a contract, correct? And in that contract, it states that for this membership price, you are really paying for access.
Right. Correct.
And a nice office, clean office, 4 seasons experience.
Yeah.
Talk to me about charging an insurance company for medical services on top of charging a patient for the concierge fee.
Right. So the question you come out to is, if I was to say it back, is I'm already paying a monthly fee. Why are you billing my insurance?
Right.
Right. So, that's a difficult question. And that is a question we have to answer to many patients every day that call us about our practice. So, and this differentiates between us and direct primary care. Yeah, I guess so direct primary care, and you can go into this a little bit more, but they don't necessarily accept traditional insurance. The benefit for the physician is, I don't have to deal with insurance anymore.
Right.
Those guys are difficult to work with. I choose to get out of it, and the patient can just pay me cash.
Right. And I know I'm probably going to offend some people by saying this, but as a physician, what little we get from an insurance company reimbursement, I think we are entitled to that. So I'm not a fan of direct primary care offices.
And not only are the physicians entitled to it because that's their pay.
Right.
The patient's entitled to use their insurance that they pay money in.
Correct. So I think it works in certain settings.
Right.
Take small town Nebraska, for example, where I'm from. And for those patients that may want to pay for direct access, they may be charged a small membership fee, or they may be charged fee for services. So you come in to see the doctor, you're charged this fee. You have blood work, you're charged this fee. You have a procedure done in the office, and you're charged that fee. So ultimately, it's fee for service.
100%.
But in a way, you're also paying for insurance that you cannot use.
If you have an $8,000 deductible, how are you supposed to meet that deductible?
You never will.
Without paying all the way up there.
Yeah, especially if you're young and healthy, you never will.
Right. And then you go to the emergency room for that one-time visit. There's $3,200 plus the scans, plus whatever.
Right. And that was one of the things I learned from my business research before I started Parker Medical was at Lifetime, we were a direct primary care office. We could not accept Medicare patients. And many patients were frustrated at the fact that they could not use insurance. And we were not very successful. And so ultimately, I feel that doing direct primary care, at least in the landscape I live in, is not conducive. And I go back to the fact that I think doctors, for as hard as we work, we should be entitled to what little bit of insurance reimbursement that we
Now, the reason for my reasoning for concierge medicine was I was and still am a hospitalist. I work in hospitals across the country. Therefore, I have to accept Medicare.
Mm-hmm.
And by law, CMS says that if I'm going to not see patients, Medicare patients, or if I'm not going to accept insurance in the clinic, in the outpatient setting, then you have to opt out of Medicare for 2 years, which means I can't work and take care of any Medicare patients at all.
Correct.
Well, that means that I can't work in the hospital. That means I can't do my job and what we're doing to build our practice. So for me, it was an essential process for me to accept insurance and to do the concierge model.
Right.
But I think we also balance that well, because some direct primary care models, DPC models, they charge very, very large fees,
Mhm.
right? And they can. That's
Rightfully so,
right.
if that's their business model.
Yeah, and so what we decided to do was we offset it by lowering our concierge fee, and then we have and then we take and bill insurance.
Mhm.
And we were talking about this earlier. My wife and I, who runs the practice with me, we have like a belief that we're the Costco model of concierge medicine. That, you go to Costco, you pay a membership fee. You also know that your product is good and nobody ever complains about the quality of the product, or that they're like the price on it is that they haven't given you the best price possible.
Mhm.
So we feel that we don't nickel and dime people. We charge them for their bill. We charge them for their visit. But when they do their labs, for example, and this is our business model,
Mhm.
we don't upcharge them on their labs, and the patients see that and they go, "Oh, this is incredible."
Yeah.
Well, I'll give you an example. We had a patient who we had to order him labs, and he wanted a specific lab request. So we ran it through his insurance, and it was going to be $1,100.
Mm.
And I was like, "Okay, well, this is your insurance." Then I asked my wife, I'm like, "Can you run that through just cash? And what would it be if we just called the company Quest, which is the lab company?"
Sure.
And it was $86. And I was like, $86?
Was it an image or what was
No, it was Quest. It was just labs. There was some biomarkers, some
Oh.
hormone testing that the patient wanted. And, it wasn't covered under their insurance. So it was $1,100 if he ran it through. So, and he didn't meet his deductible. So that would have been $1,100 out of his pocket.
versus paying $86 cash?
So that's where we feel we can offset some of the pricing. Now, does that benefit us as a clinic? No, that's a loss. But at the end of the day, we are not trying to nickel and dime our patients.
Right. And just for clarification, Quest is who is billing the patient, not your clinic.
That's correct.
Yeah.
Yep.
So
Exactly.
if the patient used their insurance and decided to have their labs processed through Quest, $1,100, as opposed to just saying, what is the best cash price for this patient? $86. Still pay them, but we're not going to use your insurance.
Exactly.
Yeah. So I think in general, what I have learned is, yes, we may charge a membership fee, and yes, we will bill your insurance for any medical services that are rendered in the office. But I truly believe that patients are actually paying less out of pocket than going to a traditional office.
Mm-hmm. Absolutely.
So,
Yep.
Do you want to ask me the question? Would I see a concierge doctor?
Oh, I probably try to get you to sign up to my clinic.
Yeah. You're too expensive.
So, but in Las Vegas,
Yeah.
where you are, would you sign up for a concierge doctor?
I would say maybe, I feel relatively healthy. I don't have a lot of medical conditions necessarily, and I take very good care of myself. So at this stage in my life, probably not.
Yeah.
But I know if I was a patient that had a lot of medical problems, that I absolutely would be in a concierge office, because just think about this. How nice would it be if you wake up and it's 2:00 in the morning and you are sick, you pick up the phone and you call your doctor, and that doctor can either provide some reassurance, again, depending on the situation, maybe come to your house, maybe you meet them at the clinic.
Yep.
And you, in your best judgment, do whatever you can to prevent them from going to the emergency room, right?
Yeah.
Obviously, if they're having acute coronary syndrome, you know what to do. But I think it's nice for those patients who just need someone to be there for them. At the end of the day, people want to be taken care of and know that someone is going to be there for them to weather the storm.
So one of the colleagues that we've met through developing our concierge practice here in Tampa, Dr. Lisa Hayes, she's a pediatrician, she's a DPC, and she was telling me of stories of how many ER visits she has saved for her young patients from going to the emergency room. Now, remember, I told you the costs here. And the one thing with having a child is every child will see the emergency room at least 2 to 3 times by the time they're 5 years old.
Yeah.
So, and some kids have reactive airway disease, asthma. These are more likely to go to the emergency room, especially in the middle of the night. I mean, imagine her, in her practice, she goes to their house and she's able to provide, life-saving medication at home for a smaller fee. And I mean, like, it's an incredible idea.
Yeah.
And her patients absolutely love her.
Yeah.
The families love her.
Yeah.
So I was thinking, like, this is like a model that needs to be provided to the rest of the
100%.
Yeah.
And it's, I'm going to go on a tangent a little bit, but, how often do we see those providers who are internists, family physicians, primary care docs, who obviously, I think in our field, traditional medicine insurance reimbursement is low, if not getting lower, which from a business perspective means that you have to see more patients just to keep your lights on. So in my situation, seeing 50 people a day, there was no life in that. And certainly I don't think even great care for the patients that I was serving. So it was a detriment, I think, to both. But I just, I kind of lost my train of thought there for a second, but ultimately I think patients are willing to pay a little bit extra for that level of care. And
so when we were driving from Fargo, North Dakota to Tampa, Florida, in the same pickup I have. Mm-hmm. So we sold everything in Fargo, North Dakota, put everything in a U-Haul, hitched it to my truck, and decided to drive south. Mm-hmm. Okay. And packed 2 kids, 2 dogs, my wife, and whatever's belongings we had, pulled it along. And when we got to Tampa, on the way there, I listened to a podcast. And that podcast, I love podcasts, So
yeah.
Hence this thing we're doing. So there was a podcast that I was trying to figure out, like, is there a podcast to how to start a clinic?
Yeah.
And so, like, I was thinking that I was going to come out and start a primary clinic. Like, that was what the goal was. And I initially thought of Concierge, but until I met you, I really didn't understand it.
Yeah.
And I'm listening to this podcast, and I'm thinking, this is so complex. Like, it is so ridiculous.
Where do you get started, right?
Insurance pre-authorizations, lab, CLIA waivers, this stuff, that stuff. And like, and the big thing about it was, how do you get extra revenue from non-patient services? Mm-hmm. i.e., how do you squeeze the shit out of your patients? Mm-hmm. That was half the conversation.
Right.
And like, that made me feel like upselling. Yeah. I used to work in restaurants and we used to upsell. I used to work in Applebee's. Yeah. Upsell for the the drink, what was it? The Bahama Mama. That's what they used to sell.
Get really drunk on those, right?
You get 1 or 2. You upsell the drinks, you upsell the steak, you get the steak, you upsell, you get the ribs, you upsell for the full rack, right? I get the reason for that. Yeah. Why are you doing that in healthcare? Right. It's not because the physicians are bad people. Yeah. It's because they can't afford to run their clinic based on the current revenue that they're pulling.
And they're looking for other revenue sources. That's what I was starting to mention earlier before I went on a tangent. Primary care docs, how many times do you see them dabbling in aesthetics now? Yeah. Not to say that they're not maybe good at it, but now they're dabbling in aesthetics, or they're trying to implement more of these aesthetic procedures in their office to try and generate more revenue because they're not getting anything from insurance. I don't like that. I feel as an internist, that's not our area of expertise. I hate to say that, but they are looking for more revenue. And I think at the end of the day, patients just want to be taken care of. Yeah. They don't necessarily want to be dabbled in this and that. Patients want a primary care doctor that's going to be there for them, and they want that relationship at the end of the day. That's what I meant to say.
Jeff Bezos once said about Amazon, like, the purpose of Amazon was like an incessant focus on customer service. And I think that's what I think we need to do in the concierge world, right? Is incredible focus on the patient experience, and the rest will come. Right. If you make sure that experience is premier, then we've validated our system, right? Yeah. So I think, like, that's a big thing. the interesting thing about the Botox thing that you mentioned,
Yeah.
when we moved to Tampa, like the first place we were staying, we met a realtor, and the realtor was showing us around buildings that we could potentially buy for a medical practice. Sure. And one of the first places she showed me was one owned by a family physician, and the ER physician was 2 people, and they both turned it into Botox factories. And I was like, but you were at ER, and their goal was urgent care or something. And then they said, the heck with this current system. I just want to make it easy, whatever revenue is coming in. And I don't blame them.
Yeah, I don't either.
Like that's how it is. Yeah. But that's a consequence of the convoluted system that we have.
And meanwhile, we don't have enough primary care docs, right? So is that contributing to the shortage, right? That's a whole other topic.
Yeah.
What are some of the reasons that a patient may want to consider a concierge doctor?
So of the people that we have had in our clinic that come to join our concierge practice so a lot of it's been word of mouth, that we love the experience. That's a big thing. Their initial time that they come, I don't think they even really know the benefits of it. They've been just told, you gotta try it. You gotta do it. It's worth it. So I think so far our patients haven't come to us and said, we have a specific focus. I had one patient who came to me and said, look, I've been paying a provider for X amount of years. I pay a monthly fee. And I used to be able to get a hold of them within, if I needed a script or if I'm going on a trip, if I needed to get some evaluation before, I could call them and within a day I could get seen. It got to the point where now it was set out for 2 weeks. And so I need a provider who can guarantee me that. And I said, well, I'm here for you. You know, that's my purpose.
Easy.
So that niche of a very busy individual worked out.
Yeah.
But the rest of them they just want to have a good relationship.
Yeah.
They just want to work with somebody and they want to have the same doctor. They don't want to go to the clinic and say, well, I have a 15-minute appointment. Let me put you in with so-and-so. You've never met him. They have no idea who you are. You're coming to show a rash or something. That rash may be completely new to them. Yeah. So the patient said, I just want the one same guy.
Yeah. I have to share this story of a patient of mine who's been with me really since the beginning. And sometimes I wonder if she can even afford me sometimes. And, there are times that her monthly membership may not go through or whatnot. And we have to get in touch with her. But, she is someone that was kind of a product of this broken system, was in the emergency room constantly, significant mental illness. And I realize the impact of having a relationship with a patient because I see her every week. And I look at her in the face and I ask her, how are you going to make it through this week? She was on 40 different medications. We got her down to 5 and she is thriving, successful, doing so much better. And how could we see that outcome in a traditional setting? You could not. And for the previous doctors that she was seeing, it's easy just to say, go to the ER. We all have those patients that are challenging. We've all been there, but, and I'm not anybody special other than taking the time to hold her hand and say, you are going to get through this.
Right.
And I think that's the beautiful thing about concierge medicine in this setting. So
tell me about Parker Medical. Give me a little bit of information on that.
Yeah. So Parker Medical is, we call it a luxury medical brand. And it is a 100% primary care office. We have 3 physicians, 12 employees altogether. And our number one goal is to really give patients an amazing experience from the time you walk in to the time you leave. So I did not want to have a waiting room, as you alluded to earlier. I wanted patients to walk into almost a living room, like they were walking into home. I've trained my staff very well that when the patient comes in, I want them to be greeted. You are going to be judged within the first 10 seconds of your experience. And how many times have we seen walk into situations and they're not giving you the attention that you may need or the services that you're hoping for? And you can really judge pretty quickly. So patients are never double booked. So if your appointment's at 11:30, you are the only patient in the office at that time. We're going to start on time. And really, we spend anywhere from 60 to 90 minutes with patients. A lot of it is really, obviously talking about their medical concerns, but it also goes beyond that. I mean, I have formed some amazing relationships with patients where we take the time to talk about, their family vacation, or maybe a death in their family, or maybe that their granddaughter had just gotten into Yale and was so excited about that. So it's really sharing in a lot of these patient stories, and I'm so appreciative of these stories that I've learned. It's made me a better doctor at the end of the day. But I also say we stand by our word. If we're going to do something, we follow up. If I want my patients to have an MRI, they're going to get that the same day. If I want my patients to have blood work done, they're going to do that the same day. And they'll probably get the results of that MRI the same day too, and a good game plan instead of waiting forever and ever and not having any answers. So we do our best to really expedite care. If there is, obviously I'm just an internist. I'm not a cardiologist. I'm not a nephrologist, but I have developed a lot of close relationships with specialists that if I need anything, I can absolutely call and they will be seen same day.
Absolutely.
So I think for anybody such as yourself that's just starting out, it's really important to develop those relationships with specialists.
Yeah.
Because they can really help you out when you need it.
I agree with you. You know what? That is, I feel like for somebody who's starting off a practice, especially in like a new town where you don't know anyone.
Yeah.
That is something I experienced was a little bit of a difficulty, is like, which provider, which cardiologist, which nephrologist, that you want somebody who you work with well,
right,
who you trust, who also is going to give a good experience.
And you want to know who they are, because if you're referring to them, you want to know their ethic and how they practice.
Absolutely.
So it's really important to have those relationships.
So regarding concierge medicine in the future, where do you see concierge medicine in the next 5 years, in the next 10 years?
I think the system is going to probably force more doctors into this. I don't know, given what's currently happening, how much longer we can keep at this pace. Doctors, this is the one profession where the highest suicide rates and the highest burnout rates. So I think that there is going to have to be something drastically changed, because we can't keep going at this pace. I truly believe in the next 5 years, certainly in the next 10 years, more and more doctors are going to go in this path.
Right.
And yes, you may see more of those patients that can afford having a concierge doctor and having that level of care and that they want that level of care.
Right.
And then another group of patients who may be forced into another system that just need the care.
So you're saying that the response, not only for patients and having a better experience, but the doctors themselves to have a better experience in work life and work balance,
correct,
would be the response of a concierge medicine.
Correct. So what do you say to other colleagues? And I've gotten this question, Dr. Parker, how dare you be a concierge doctor, because you are contributing to the physician shortage?
You know what? I'm going to be honest with you. This is a hot take, okay? I don't believe in the physician shortage. I think that there are a large amount of physicians. I think there's a physician shortage of quality physicians.
I agree.
And I think there's so like let's call it how it is. Under the guise of physician shortages, universities have pumped out advanced practice practitioners. And advanced practice practitioners and now physician assistants to work independently on their own. Basically replacing physicians. For people to get basic primary care, it's very easy in the United States.
Mm-hmm.
They can go in any corner and get some sort of care.
Mm-hmm.
Is it? It's very varying levels of care.
Right.
And so when you had the highest level students, like I was a high achieving student, I was a high achieving resident. My goal was cardiothoracic surgery. Why? Because primary care wasn't going to pay. And why would I work in the system and they kick my butt every single day?
Mm-hmm.
That was kind of the process of it.
Mm-hmm.
Well, I think that is still an issue.
Mm-hmm.
I think now quality physicians, guys who are guys and girls, men and women who are very focused on doing a great job and making an impact. Now this is their avenue to say, you know what? Primary care is an option. Not only is an option, I can explore my entrepreneurial beliefs in there. I can try to give an option to it. I think there's a really great response to it. But for anybody to kind of shame me in the doctor shortage, there's no doctor shortage.
Well, I tell them that I would absolutely stop being a concierge doctor if insurance companies would pay me a little bit more for my time, my education. When you think about the cost of healthcare, what it takes to get an education, it's my plumber makes more money than I do.
Yeah.
So I think unless things change drastically, I'm going to help and promote more physicians to be empowered to do this.
Yeah.
I think better healthcare is in the private sector. I really do.
Oh yeah.
So
I mean, I'm born and raised in the social system.
mm-hmm.
I'm born and raised in Canada. I think are
there concierge doctors in Canada?
I told that actually, you know what? In Alberta there is. I was just talking to one of my best friends who lives in Calgary.
Yeah.
And there's a process. It's very similar to concierge medicine. And their response was they had gone to the current system and it was not what they were hoping for. It was they wanted a better connection.
Yeah.
They wanted time. They wanted access. So there is some response. Now it's different province to province, but you know, like my cousin's a physician in Canada, and I would trust her with my life. I think she's an amazing physician. But you know, hearing how difficult medicine is up there,
mm-hmm.
and then hearing my friends' experience of their experience with physician and medicine, you know, for my sake, I think the private sector has done a phenomenal job of creating an experience. I think the cost is an issue, and the cost is something that I think concierge medicine can be a way of battling those extraordinarily high costs.
Yeah. I often get asked, and again, there's many different models to concierge medicine. I often get asked, do I do house calls? And sometimes this always ends up backfiring, but I, in my practice, choose not to do house calls. I think there's many reasons for that. One, I think it can be a safety issue for me as a provider or other providers going into someone else's home. It's not in a controlled environment. I don't have all the tools and the skills or the services that I need to do that. But so I know some concierge doctors may offer that, but I don't. I think for doctors that are more private doctors, and I do think that's the difference. There's concierge, DPC, and then maybe a third tier called private medicine. I certainly, if you want me to come to your home, I think there is a price to that, and I think a very limited panel of patients. So but I go on a tangent there. So is there anything that you feel in terms of concierge medicine that there needs to be, I guess, can we do it better? Is there anything else that we can do differently?
I think I'm noticing trends in Tampa.
What sets you apart from the concierge doctor down the street?
Yeah, I'm noticing in Tampa that there's a lot of new concierge things.
Sure.
And I happen to see, like, on the interstate, it said employer-based concierge medicine. So in other words, a company would hire this company for $49 per employee, and they get concierge medicine. I looked into it a little bit. Now, sounds like a great idea.
Yeah.
It's very affordable for an employer, right? And imagine, this is like healthcare for them. This is great. Like it's not concierge, right?
Right.
It's like 1 or 2 visits a month, and 1 visit a month, and every additional visit is an expensive thing. So, yeah, it sounds great to the employer in the beginning, but it potentially could be more expensive. That's the problem with this. Like, you're nickel and diming your patients again, right?
Yeah.
And so my worry about the near future is that concierge is going to go through quite a bit of waves.
Yeah.
We don't know what we are right now.
I think if you're going to do it, you have to do it well and do something that's going to set you apart.
Right.
Right. So at the end of the day, they are paying for you, but as in any business, there's always going to be some competition. I think there's plenty of patients out there that you don't need to be greedy.
Yeah.
But I think you also in this field have to do something that's going to really set you apart too. So,
amen.
So.
All right. I think that's going to lead us to the conclusion of today. This is Out of Network Podcast. Do us a favor, like and subscribe, share us on your social media, and do us a favor and shout us from the rooftops. All right?
Thanks for watching.
Thanks, guys.